Russ Toomey, speaking as part of the Pamela Turbeville Speaker Series. Person who needs no introduction here. Got his master's degree at Penn State University, and came to us and got his PhD in Family Studies and Human Development here, and then went to Arizona State University, where he worked with Professor Adrienne Rich, who is one of the superstars in our field, I think it's safe to say, and where he really sort of took on, having trained here and focused largely on sexual minority or LGBT young people in their lives, went to Arizona State and extended that with an intersectional lens with Professor Taylor to think about intersections with race, ethnicity, culture, immigration, and in fact has done some things like published one of the first empirical analyses of young people's experiences following in the middle of and as a response to SB 1070 in Arizona, some extremely exciting and innovative work looking at the intersection of race, culture, sexualities in young people's lives. He then is at Kent State back again as an assistant professor and is visiting us here today. And his CV, I think, has been circulated probably, so his CV is, exciting, amazing, full of prompting envy in many of us. So we're really pleased to have you here, and couldn't be more excited to hear more than just queer or trans for being together. Thanks.
So thank you for the introduction, and I want to extend a thank you to Jana also for inviting me to be here today. I'm really excited to be back in a place where I essentially grew up as a scholar under the excellent mentoring and other experiences I had here at the University of Arizona. So I'm excited to also be sharing with you all what I've been working on for the past 2 to 4 years, since I'm not sure many of you actually know the work that I've done up at ASU, focused on Latino youth, and now my current work, which is all focused on the intersections, as Stephen mentioned, of sexual orientation, race, ethnicity, gender expression, immigration status, and so on. So as you'll see in this presentation, I aim to infuse a collaborative approach to research with the end goal of improving the lives of young people and their families who experience bias, inequity, and marginalization in society. And so, as was already mentioned, my doctoral work, as most of you in this room know, focused on LGBT young people. I extended that to Latino youth in my postdoctoral and early assistant professor work, and now I am solely focused on the intersections of those experiences related to health, academic, and behavioral inequities, both between groups and within groups, as you'll see today. So just to orient you to my presentation today, I'm going to give you an introduction to my program of research, some of the guiding theoretical frameworks that I use. I'll then give you 2 snapshots of my research findings related to 2 very recent studies that I've been engaged in, and one of those focused on LGBT or queer youth, and then the other focused more specifically on transgender youth. And then I'll end with some future directions, implications from the 2 studies that I'm sharing with you today. So my program of research on youth with marginalized social identities, locations, really can be summarized by 2 overarching goals. And I do have in here, in parentheses, intersecting, and I'm going to get to that in the next slide. First, I'm going to talk more generally about what those 2 goals are. And these 2 goals are not mutually exclusive. So my work has largely focused on the environmental as well as interpersonal experiences that we can understand and assess that we know are associated with health and academic disparities among populations who experience bias, inequity, and marginalization in society. And this work has largely been grounded in the minority stress model, which posits that encountered minority stress as well as anticipated or expected minority stress helps to explain, a cumulative experience of that helps to explain why we see these large health disparities within these marginalized populations. And so most of my work is focused on experience bias, whether it's victimization at school, discrimination in society. That work is largely focused on Latinos, and it's also focused on policies. So Stephen actually mentioned the work that I did around SB 1070. We had a longitudinal data set, and I realized, hey, SB 1070 happened right in the middle of this data set that we had 3 generations of information on. So I recentered that, looked at, for example, then how SB 1070, a policy, can impact health engaging behaviors among Mexican origin individuals and adolescents living in Arizona. I've also looked at family rejection, family supports, and other family-related experiences to help us understand these disparities, especially among LGBTQ young people. So complementary to the first goal, I also am very interested in understanding the promotive and protective factors related to positive youth development, and how do we help facilitate positive development, healthy outcomes among LGBTQ young people as well as Latino young people, and again, that intersection. So actually, a lot of my work recently has focused on identity processes. So Dr. Umana Taylor is the leading expert in ethnic racial identity development at this time, and she has really helped me to think about how this process could be also examined from an identity, traditional identity perspective among sexual orientation identity development. So in one of my projects that I'm presenting today, I'm not going to talk about identity, but I have developed new measures that I'm really excited to get in and assess and look at. Examine family relationships. Here I'm focused again more on the support rather than those negative rejecting behaviors. Group belonging and participation, both looking at GSAs, which was most of my dissertation work, but also then looking at Latino youth in similar type clubs and schools, and how that can be protective or promotive of well-being. And then policies again, so looking at things like safe schools policies, but also how can we help guide policies so that we can ensure healthy development for all young people, regardless of their identity in society. So as I mentioned, this intersectionality perspective has infiltrated my work. And I just want to share with you a quote by Adrienne Rich. And Adrienne says, when someone with the authority of a teacher, say, describes the world and you are not in it, there is a moment of psychic disequilibrium, as if you looked into a mirror and saw nothing. So what a better mirror than the Chicago beam, right? And actually the Chicago beam, when you go, how many of you have seen the Chicago beam? Probably most of you. So when you go up to it, it looks like it's just one big piece of metal, right? And you can't see the seams from all the different pieces that were welded together. And so we often in research just look at a person at one of those seams instead of trying to assess that whole person, or in this case, the whole being. And so this perspective that is feminist informed, coming from a sociology and legal perspective, has really influenced a lot of the work that I'm doing now. And I think that this is important because change is happening. And so many of you know the US population is drastically changing in many different ways. Age, race, ethnicity, immigration status, nativity status. It's changing in many different ways. And I believe that science must change to also address and meet the needs of a changing global population. So right now we still, in most of our studies, only look at one aspect of a young person's life in particular. And so I believe that we need to address these multiple social identities and locations that we all inhabit that are inextricably linked to power, oppression, and equity. So this graph just shows you, I'm sure, the demographics that you're all aware of. So the U.S. Census and the Pew Research Center estimate by 2043 that in the U.S. we will have reached minority-majority tipping points in the overall population. Importantly, among young people, that's expected to happen within the next 3 to 4 years. So when we're looking at kids 18 and under, this majority-minority tipping point is expected to happen before 2020. And here we also see the largest population that is growing is the Latino population. Of course, here in Arizona, you see that more readily, but actually in Ohio, where I am, we're seeing a huge increase in the Latino population, even in rural Midwestern Ohio. So, related to research, the extant literature on youth outcomes attempts to classify youth into unitary classifications. So we know a lot about the disparities related to a young person's sexual orientation. We know a lot about disparities related to gender expression. We know a lot related to race ethnicity, but it's been a very siloed approach. And unfortunately, these literatures have rarely even communicated with each other. And so one of the reasons I sought out the postdoc that I originally did was to really gain this expertise in race ethnicity specifically, to be able to merge that literature and some of the promotive and protective factors that they've identified in with LGBTQ-related research. And the problem with the siloed approach, of course it's important. We need to document disparities by these different groups. So I'm not discounting that research. It's incredibly important. But the methods that we use prioritize the examination of between group differences rather than the heterogeneity that we know also exists within different groups. So not all Latinos are the same. So we know that there is heterogeneity within those experiences. And I believe, as well as others in the field, that these priorities of examining these group differences in silos prioritizes that between group membership and doesn't allow for the actual practice of informing prevention intervention, which we know is most effective when it's tailored to that young person. So if we can tailor our prevention intervention programmings around how these different identities, locations intersect, we will likely see much more fruitful results from those intervention and prevention programs. So the intersectionality framework, if you're not familiar with it, I just wanted to give you a little bit of background. So it was originally coined by feminist scholar Kimberly Crenshaw in 1989, who was a feminist sociologist and legal scholar. And she really developed this framework and suggests that individuals are an amalgamation of their multiple constructed identities and realities, and that these embodiments interact to inform the inequity and social oppression that they experience, and that these identities are interlocking and interweaving. And she developed this to try to understand why black women experience harassment in the workplace. Was it related to their race? Was it related to their status as a woman in the workplace? And she realized that she couldn't really pull those apart. We couldn't disentangle and identify where that harassment was coming from. So now I'm going to move into a snapshot, so get into the data and show you what I'm working on based on this intersectional perspective. So this first study that I'm going to share with you is actually like hot off the press data. I just downloaded it from Qualtrics, an online survey mechanism, in late January, and so I'm really excited to share this with you all and hear what you will have to say. So it's examining Latino queer youth's experience of parental preparation for bias, and I'll talk about that in a bit, their actual experience of bias, and how that is related to their well-being. So, Latino LGBTQ youth. We actually don't know a lot about this population. Most of our work that we know about Latino LGBTQ individuals is understood from an adult perspective. And so we have actually quite a bit of research on LGBTQ Latino adults, but not very much on young people. Both of these populations are at disparate risk for poor health outcomes, as well as academic and behavioral outcomes. And we know that encountered bias in both of these groups contributes to why these disparities exist. It's not that they're inherently a risky population, but it's the encountered bias oppression that they experience in society. So most of this research, especially among LGBTQ youth, has looked at things like school victimization, experiencing bias-based victimization in the school context, or experiencing bias from families and family rejection, And discrimination among Latino youth is where we actually see the most sizable associations between bias and well-being for Latino youth. And so this is looking at discrimination more in general in society. So in people of authority, store clerks, police officers, teachers, is there a perception that a young person is encountering discrimination? And we know from some of my work and Stephen's work that bias-based victimization is more strongly linked to health and well-being outcomes than more general forms of encountered victimization. So when we look at things like school victimization and we don't assess whether that was attributed to a particular characteristic of that young person, we know that when young people say it is attributed to one of those characteristics, it has stronger implications for health and well-being. Few studies, though, examine the co-occurrence of this event or of these experiences. So Latino, young, queer, or LGBTQ people are likely experiencing both discrimination related to their race, ethnicity, as well as related to their sexual orientation or gender identity and expression. So we also know that family is an important context, of course, where we learn, where children especially learn about their race, ethnicity, and they learn about their race, ethnicity from both implicit, explicit, as well as intended or unintended messages from their family. So there's this great literature on family, ethnic, racial socialization and how that process occurs in families with children and adolescents. And one of the components of racial and ethnic family socialization is this idea of preparation for bias. So what are parents doing to talk to their kids? How are they talking to them about the bias that they will likely encounter in society? And there's mixed evidence for Latino youth about whether this is actually protective or promotive of health and well-being or not. Among Black, African American young people, there are generally very strong associations between this and health and well-being, and it interacts with encountered bias to reduce that negative association between bias, encountered bias, and well-being. But the evidence is really mixed for Latino youth. We know that more culturally specific racial ethnic socialization not specific to bias is associated with well-being among Latino youth, but again, mixed evidence for preparation for bias specifically. Some studies have found that it has buffered encountered discrimination, but others do not find moderation. So this is an area ripe for research where we need replication. We need to understand these processes and whether they may differ based on country of origin, for example, or nativity status, or acculturation, and so on. So this idea of parent preparation for bias, though, has been largely unexplored among LGBTQ youth, even though we know that LGBTQ youth experience bias in society. And this may be because, often parents and LGBTQ youth do not share a similar sexual orientation identity. So it tends to be in most families that parents are heterosexual identified and that young people then are LGBTQ identified. And myself included, some have speculated that maybe this process doesn't happen for LGBTQ youth because of this disconnect between parents and their adolescents' own sexual orientation identities. And so maybe they don't engage in this process, or maybe they can't, or they feel like they don't know how. With the exception of one study, which I'll talk about in a minute, really nobody has explored this. There is one qualitative study that I could find of trans youth in particular that examines parents' narratives about the conversations they have with their children about bias. And interestingly, the parents of these trans youth say, we're warning our child, I'm warning you, you can't go out in a dress because you're going to experience these negative things if I let you leave the house looking like this. And so it's talked about in that study as warning rather than preparing, which is an important difference that we'll get back to. So the current study is framed by this intersectional perspective and the minority stress model. and it has two goals. The first is to first examine the co-occurrence of these encountered bias experiences related to race, ethnicity, and sexual orientation, and then to examine the possible moderating role of preparation for bias on that association between encountered bias and well-being. So this was an online study of Latino LGBTQ youth collected in late October to mid-November of last year. Recruitment messages were kindly posted by my friends at GLSEN, the Gay, Lesbian, Straight Education Network, on their social media outlets where many youth are, including Latino youth. Most youth now have access in some way, shape, or form to internet and to social media outlets. So this was posted on their Facebook, their Instagram, their Twitter, as well as other social media outlets. And we also directly emailed local GLSEN chapters in states with high proportions of Latino residents in hopes to gain a large enough sample. Survey was available in both English and Spanish. If you have questions about the translation process, I can answer that at the end. 40% of our participants actually did take the survey in Spanish, so we had a great variability in the language that they decided to take the survey in. The inclusion criteria was 14 to 24, and I did that so that I could look at cross-sectionally those differences between adolescents and young adults to be able to, especially with identity, look at any potential initial differences. They had to live in the U.S., identify as LGBTQ, and also identify as Latino. And they were offered $10 in Amazon.com gift cards for their participation. So the final sample, I'm only presenting a subsample today, but the final sample was 444 youth completed the survey, and they actually, I ran out of money in the first 2 days that the survey was open. And I'd just like to share this because I had to close down the survey because I ran out of money. And while I was working with my dean to obtain more funding for the study, I would get emails from these young people saying, I want to take your survey, it's closed, what do I do? And so I'd email them back and say, I'm working on trying to find more money so that I can compensate you and pay you for your time taking the survey like I have others. And they would write back and say, can you just open it back up? I don't care about the money, I just want to take the survey because nobody's ever asked me about my experience as a Latino LGBTQ young person. And so that just spoke volumes to me that this is a population that really wants to share their voice. They obviously do not feel like they have been heard. And some of them live in rural environments, and so that may be part of it, right? Because we tend to do these types of studies in more urban centers. So they range in age from 14 to 24. So this is a subsample of 238 that were in school. And so the measure of in-school victimization, I didn't want to have young people who were not in school because that measure wouldn't make conceptual sense. So 14 to 24, so some were in college. And I'm hoping to do some analyses later looking at the potential differences. 94% were born in the US, so not a lot of variability with regard to nativity status. 67%, the majority, were from Mexico or their families originated from Mexico, which aligns well with national statistics on who Latinos are in the US. 20% Puerto Rican, and 4.2% from Cuba, and then 9.6% were from a variety of different Latin countries, and it was very difficult. It would take up a whole slide to list all of them. Most identified as male, which is consistent with other online research on LGBTQ populations. Apparently lesbians and bisexual women don't take online surveys. And so that's just a tricky issue that anybody that does online survey with this population has to deal with. 10% did identify as trans, so I was excited to see that population represented as well in this study. Yeah. So trans, I had a very inclusive gender identity question that said check all that apply, male, female, transgender, male to female, transgender, female to male, transgender, not on the binary, transgender, other, gender queer. I had like several different options for them to pick. So trans includes anyone that chose an identity other than male or female, and they could have checked multiple boxes. And so if they checked multiple boxes, including one of those trans labels, they're included here as transgender. So measures of the study. So I decided to measure for LGBTQ youth in this particular analysis, use the measure of school-based victimization. So the extant literature has primarily focused on this experience of bias rather than more global discrimination. And some of that deals with, the issue of, can others in society tell that I am an LGBTQ young person or not? And we know in school, it's more likely that they're going to be encountering that than potentially in their day-to-day lives. And so for Latino, to get at ethnicity, race ethnicity, I use the Perceived Authority Discrimination Scale. Both of these scales are widely used and widely validated among adolescent and Latino populations. I did assess both for both forms of discrimination and victimization, but I'm only using the most salient ones in this analysis that the literature would suggest are most salient. Preparation for bias also comes from a standardized measure. Diane Hughes and her colleagues focused on race ethnicity. I adapted this measure to get at sexual orientation, so nobody, again, has looked at this, so I adapted her measure to get at sexual orientation and how often, for example, in the past year, have your parents told you that you must be better to get the same reward as others because of your ethnicity, and then they were asked separately because of your sexual orientation. So getting at both of those processes separately. You can see that the means are actually pretty similar. So they're experiencing preparation for bias relatively at the same level, at least at the group mean for being Latino and being LGBTQ. I also assessed enculturation to include as a covariate in these analyses because we know that enculturation or the process of how this is a behavioral measure of enculturation, so how much they're using Spanish, how much they associate with other Latinos versus Anglos. We know that that is associated with well-being, so I'm using that as a covariate. And then my two outcomes are self-esteem and depressive symptoms measured by standard measures. So results for the first analysis. Looking at the co-occurrence of these processes. So this was done in a latent framework. I'm just presenting it here because I think it's probably easier to read in a correlation table, but these are latent correlations between these constructs. And so here you're looking at 1 and 3 for this first one. How strongly associated are victimization experiences related to sexual orientation and experiences of discrimination related to your ethnicity as a Latino person. And so we see that the correlation is actually very high, 0.74. And so youth, when they're experiencing one form of bias, are also more likely to report that they're experiencing this other form of encountered bias. Same with preparation for bias. So here we're looking at 2 with 4, and so we see 0.55 correlation between preparation for bias. So kids who are reporting, young people who are reporting that their parents are preparing them for bias related to race ethnicity are also more likely to report that they're experiencing this related to their sexual orientation. I did do some CFA nested model comparisons to make sure that they were indeed measuring distinct constructs, and they could not be constrained to one. And so it's not just that they're just thinking about bias in general or that they're thinking about parent preparation in general. They are distinct constructs. So they were able, in the survey and in the reporting of these items, to think of these as distinct experiences. So then moving to the beef of this paper, how did then these experiences of preparation for bias interact with encountered bias to inform well-being? So I'm just going to start over here on the left-hand side, and the color is not great on this projector. But the solid lines represent positive associations, and the dashed or dotted lines report negative, indicate negative associations. So it's not, oftentimes we use dash for not significant, but in here it's negative, so just so that you could more clearly see. So age was positively associated with discrimination, victimization, and both forms of preparation for bias. So older youth were reporting more encountered bias and more preparation for bias. Makes sense from a developmental perspective that their parents have talked to them more frequently about these issues. Being female was negatively associated with preparation for bias related to one's ethnicity as Latina, and negatively associated with victimization because of LGBTQ status. So both of these are consistent with the literature. So among Latinos in general, we see less preparation for bias compared to Latino boys in the literature. And we tend to see males reporting higher levels of victimization related to sexual orientation compared to females. Trans youth, being trans was negatively associated with discrimination related to ethnicity and victimization related to sexual orientation, and it was also negatively related to preparation for bias related to one's ethnicity. And so this one, for this association, this negative association, we're not tapping into gender identity and expression in this victimization measure. It's solely about sexual orientation, so I think that's why we're finding this negative association for trans youth. But this needs to be explored greater. So what is it about being a trans person that your parents are less likely to talk to you about your ethnicity? And there's no difference related to preparation for bias related to sexual orientation. So that needs to be fleshed out some more, probably with more mixed methods. Enculturation was positively associated with preparation for bias related to ethnicity, positively associated with victimization related to sexual orientation, and positively related to preparation for bias related to sexual orientation. Again, not surprising. The more you espouse more traditional Latino culture by speaking Spanish, associating with other people who are Latino, your parents are more likely to probably talk to you about that, and you maybe talk to more about sexual orientation because potentially there's that cultural issue of it not being as acceptable in more enculturated family dynamics. So then looking at the second half of the model, I'm going to start with discrimination and preparation for bias related to being Latino. So we see discrimination is positively associated with depressive symptoms, and preparation for bias is positively associated with self-esteem and negatively associated with depressive symptoms. So again, the literature in this area is really mixed, and so I'm adding yet an additional finding to this literature suggesting that perhaps in this case, preparation for bias related to ethnicity is a promotive or a positive factor in these young people's lives. Victimization for being LGBTQ was not associated with well-being among this sample of LGBTQ Latino youth, which I think is actually a really important finding when we're also controlling for their discrimination as a Latino in society, indicating perhaps that discrimination or encountered bias related to one's ethnicity is perhaps more salient than related to their sexual orientation. And then what I think of as like one of the most interesting findings from the study, preparation for bias related to sexual orientation was positively associated with depressive symptoms and negatively associated with self-esteem, but there is an interaction effect going on between encountered LGBTQ bias and that preparation for bias. So here it's graphed out for you. And the gray line at the top is high preparation for bias. It's +1 standard deviation over the mean. And we see a positive association between experience of encountered LGBTQ bias and depressive symptoms. So when youth are in families where their parents are talking a lot about the bias that they'll experience because of their sexual orientation, they're encountering more victimization at school, they're more likely to have higher depressive symptoms. And when their parents are not talking about that preparation for bias, there's no association, no significant association between encountered bias and well-being. I'm going to flush that out in a minute for you. First, I think that this study points to the important distinction that we can make, perhaps, between encountering bias related to one's ethnicity and separately encountering bias related to one's sexual orientation. And so ethnic discrimination and not sexual orientation victimization was related to poor health or in case of self-esteem, better health and well-being, or less self-esteem and more depressive symptoms. And this is actually consistent with some research that has looked within LGBTQ young people and found that the association between LGBTQ encountered victimization was stronger for white non-Latino kids. And so it's consistent with this idea that perhaps ethnicity race is more salient, at least in the US, for these young people and their well-being. So the differential findings for preparation for bias. So for LGBTQ youth, we see this increased vulnerability for depressive symptoms when they're experiencing both high encounter bias and high preparation for bias. So one explanation may be that their parents have increased their vulnerability and awareness of that potential for bias. And so they're already thinking about it, they encounter it, it's more salient for their health and well-being. Another explanation, however, and that's consistent with a minority stress framework, which not only is encounter bias, but anticipated bias. So their parents talking about this may actually increase their anticipation of encountering this bias. Fortunately, it's cross-sectional data, so I don't know which happened first. Is it preparation for bias or is it encounter bias? But I'm also thinking that this preparation for bias construct around sexual orientation is actually tapping into a component or a facet of family rejection. And so I did find a small but significant association between family supports and preparation for bias. So young people who felt more support reported less preparation for bias. So I'm really thinking that this is, instead of being preparing their kids, it may be related to this one trans qualitative study that was really about warning. And so I think future research really needs to delve into this deeper. So limitations, and I'm just going to go through these quickly so we can move on to the next study. But cross-sectional study, again, I don't know what came first. Was it the preparation for bias? Was it the encounter bias? Does that matter? And so we really need longitudinal methods to assess this. I view this as pilot data. It's part of my NIH loan repayment award to then, hopefully submit an R01 to be able to look at this longitudinally for these young people. Relied on self-reports. In LGBTQ research, we rarely involve parents in the research, and I really think it's important that moving forward that we include parents in the research. There have been some people who have successfully done it, and I think generally we're just afraid to do it, but I think that parents will engage in this research if we try to engage them in appropriate ways. Generalizability, it's only in school youth, so I'm not able to talk to that high proportion of homeless youth who are LGBTQ, who are maybe perhaps not experiencing this parent preparation for bias, or those who have been pushed out of school, which has been now well documented. So then future directions, I think it provides groundwork for future studies to really understand these important family relationships with culture, sexual orientation, and then later gender identity and expression, and how they then inform inequities in society, and examine associations between family acceptance and family rejection and preparation for bias. So how are parents talking about this? And I think this really requires a mixed methods approach, at least initially. So then snapshot 2, and sorry for some of you who are SRCD, you saw some of these findings over the weekend. But this is focused on trans youth. So I got this, was offered this amazing opportunity to analyze Search Institute data, one of the premier positive youth development organizations in the United States. And they have data, amazing data of over 50,000 adolescents, and they finally asked about gender identity and expression on their 2012, beginning in 2012, they included trans and other trans labels on their survey for the first time ever. And so there are, as you'll see, over 1,000 kids who identified as trans in this sample of over 50,000. So here I'm using trans again as an umbrella term to encompass not only youth who are transitioning from sex assigned at birth to gender identity that they believe or that they're expressing, but includes those who are more genderqueer and gender fluid. So we know that trans youth have high levels of poor mental health and well-being, so high high levels of suicide ideation and attempt risk, as well as high levels of depression. We don't have good comparative data. So if we're looking at between group comparative data, we don't have good comparison data for this population because it is a small percentage of the population, so it's really hard to tap into unless you have large, big data sets like this. The risk is greatest in adolescents, at least from these few studies that are cross-sectional in nature that have both adolescents and adults. The risk is heightened in adolescents, which is consistent also with some recent findings in sexual orientation research. And again, here, minority stress framework is generally used to understand why these differences may exist between transgender and cisgender youth. So, also, the minority stress framework posits that maladjustment or poor outcomes can be modified by protective factors, and I also use the risk and resilience perspective a lot in my research, which also suggests that we need to move beyond just identifying risk, but what are the factors that can promote well-being and protect youth in the context of oppression and social inequity. So the literature is largely void of any of this information for trans youth specifically. We do have a few studies that look at school policies. Usually those include those sexual orientation and trans-inclusive policies, and so there has not been a large focus on what can we do specifically for trans youth separate from sexual orientation to help promote well-being. So having inclusive school policies, feeling connected to supportive teachers at school, and then one study has looked at more internal type of assets, so having high self-esteem or personal mastery related to better well-being. So again, nobody really has looked at intersectionality among trans samples. There are a few studies. These are adults. And so there have been no studies of young people looking at intersectional experiences among trans youth. So among adults, trans people of color are at greater risk compared to white trans individuals. Trans men are people who were born assigned female at birth, who identify as males, experience greater suicide risk, and those in low or middle socioeconomic status households were also at greater risk. So this is framed from the developmental assets approach. Given that search data, I have to use their developmental assets approach. And this is an approach that is a structure or a set of developmental experiences that includes supports that set youth on a path towards thriving. Support has been found for some of the measurement of these 40 developmental assets across studies and across demographics. If you're not familiar with them, there are 4 domains of external assets and 4 domains of internal assets that are hypothesized, conceptualized to lead to thriving. So this study had 3 goals. First was to understand what kinds of profiles of internal and external assets exist among young people who are trans. The second is to understand how trans youth's different social identities and locations inform their presence in one of these different profiles of internal and external assets separately. And then how do these different profiles relate to well-being? So this method, again, uses the profiles of student life, attitudes, and behavior survey. I'm utilizing data from June 1st, 2012, when that question was introduced, until September 30th, 2013. Just over 50,000 adolescents in schools, so the survey is done in schools, ages 11 to 19, and it assesses a variety of their experiences with these developmental assets, thriving, as well as risk, indicators of risk. So over 1,000 of these youth identified as trans. We can come back to that later if you have questions about that. But they were diverse in terms of age, gender identity, in terms of how they identified as trans, diverse in terms of their sexual orientation, urbanicity. 47% are in rural areas, which is just amazing to have this kind of data compared to what we have from urban centers. Ethnicity, only 34% were white, so there's a lot of diversity in terms of race, ethnicity. And 50% had a parent with at least 1 college degree, so it's a relatively middle SES sample, and that is largely due to how search connects with the schools that conduct these surveys. So the measures, external assets, again, these 4 domains: support, empowerment, boundaries, expectations, and constructive use of time, all measured with multiple items and have good reliability. Internal assets, 4 domains: commitment to learning, positive values, social competencies, and positive identity. Again, all measured with multiple items and have good reliability. And I'm using these 4 domains for each as indicators of these latent profiles that I'll talk about next. So depressive symptoms, this is kind of the downfall of secondary data analysis, but depressive symptoms was measured by 1 item, and suicide attempts was measured by 1 item, but these are consistent with youth risk behavior surveillance survey questions that are widely used as well. So here I'm using latent profile analysis for the first aim to understand how these youth fall into these different profiles, and I'm classifying them into internal profiles and external asset profiles separately because the prevention intervention strategies would be different for those 2 types of assets. So external assets, we know that lower AIC, BIC are indicative of a better model fit. We never want less than 5% in a particular profile within our smallest class of a profile. We want entropy to be around 0.8, and we like to see the adjusted Low-Mendel-Rubin test to be significant. Here, a 4-profile solution was deemed to be the best fit. Even though profile 5 met all of those criteria, it was significant at the p less than 0.05 value. Because of this large sample size, we felt more confident going with a stricter guideline around that significance level. And profile 5 did not make any conceptual sense when I looked at it. So how do these play out for young trans adolescents? So there are 4 profiles, just moving from left to right. So the lighter gold bar is about 9% of the sample, and those were youth who had high levels of all of these 4 domains of external assets. 9% though, very small subsample. Blue is high boundaries. These are young people who had moderate levels of external assets and then high levels of boundaries. So their parents, their teachers are expecting a lot out of them and have set up rigid boundaries for their autonomy, for example. The brown bar is 16% of the sample, and they are higher on levels of support, but then moderate on levels of empowerment and boundaries and expectations. And then 55% of these young trans kids fell into the low external asset profile. So these are much lower, as you can see on this graph, compared to these other profiles. So the majority of trans youth have very little access to external assets in their life. For the intersectional perspective, I'm just going to go through these quickly. There is some consistency across these high asset profiles, but kids with with parents who have higher levels of education were more likely to be in these high asset categories compared to low asset categories. Makes sense. Kids who identified as anything other than straight, as completely straight, were less likely to be in the high external assets. So kids who are trans and queer are more likely to be in the low asset profile compared to any of these high external assets. And same here with high support. So gay or lesbian youth were less likely to be in this profile. Age, older trans youth were less likely to be in the high external assets category. Again, they have more autonomy. They may be more likely to be out compared to the younger trans kids in the sample. And then American Indian youth were actually more likely to be in this high external asset category. And we can, again, delve into that in questions. But I think it's related to the Two-Spirit identity in several Native American Indian tribes that is actually valued rather than marginalized. So internal assets, nothing spectacular. It's a 2-profile solution, so pretty boring, in fact. So you're either high or you're low on internal assets. Across the blue bar is high internal assets. The gold bar is low internal assets. 64% of the sample fell into this low internal asset profile. Then looking at intersectionality here, we see some of the similar findings as we did for external assets, but a few new ones appear. So being in an urban environment, youth were more likely to have high internal assets compared to low internal assets. Youth who were gender queer, gender questioning, instead of on the binary, so instead of F to M or M to F, were less likely to be in high internal assets. And youth of color in general were less likely to be in the high internal asset category compared to the low internal asset category. And again, kids who had parents with higher levels of education were more likely to have, or more likely to be in this high internal asset profile. And then looking at suicide attempts and depression, we see that after controlling for external assets, low internal assets or high internal assets are not associated with depression or suicide risk. But in fact, it seems to be that external assets are most salient for understanding well-being. So that has a lot of implications for prevention intervention that I'll talk about next. And the biggest reduction or drop in risk for suicide attempts among trans youth and depression occurs when, of course, there are high levels of all four domains of external assets. So just briefly, discussion here, trans youth, I think we can see with the proportion of youth in these low asset profiles that this is a population risk or population that's ripe for prevention intervention efforts. And I'm just going to skip down to this last bullet point, that these efforts might be most effective when they're targeted at these external supports. So prevention not aimed directly at the young trans person, but how do we shape, how do we mold parents, school teachers, community practitioners to provide places where all youth can thrive. And again, intersectionality matters. So we saw from those differences within profiles that youth with multiple marginalized positions in society were less likely to be in these high asset profiles. Limitations, no trans-specific measures of anything, risk or protection. That's what we get when we have large-scale survey data. Single-item indicators, I've already mentioned that. And again, cross-sectional design. So it's an amazing data set for initial estimates, but further research needs to look longitudinally to examine associations between profiles of assets and well-being. So putting these two studies together, I think there are three major points that link these studies together. First, intersectionality matters. I think we see that from both studies, that we have to move beyond just examining one aspect of a young person's life. And if it's not perfect in quantitative data to be able to do this, intersectionality was derived as a qualitative method looking at narratives. But I think that this will give us the opportunity to understand where we might target our prevention intervention efforts that may be most effective. And so that need for systemic prevention. So with these external assets, those cross a myriad of youth's contexts. And so we can't just focus on school, we can't just focus on family, but we need a systemic prevention intervention effort. And that we need to start assessing in, for instance, studies of LGBTQ young people or trans young people, processes related to ethnic identity or race identity, and how do those interplay and interact to inform well-being. Kind of slow to warm up there. So just some of my future research directions based on this. So we need longitudinal data to really understand the associations and what's going on. And so I'm in the process of developing a multi-site R01 to understand these intersectional youth experiences related to sexual orientation, gender expression, and race ethnicity, understand protective processes from both aspects or multiple aspects of their life, and their links to health disparities. I have a R03 under review right now that will give us some preliminary data as well as the studies I presented today, and a private foundation that should grant that we have our fingers crossed will be funded this round to provide this initial baseline data that we need for an R01. And thinking long-term, like what are my goals long-term? It's really to develop mental health promotion programs for LGBTQ or trans youth. So it's just amazing that in 2015, there's not a single empirically validated prevention or mental health promotion for this population, and especially for LGBTQ youth of color. And so it's really important as our demographic changes to be able to assess these things in meaningful ways and understand how they impact young people's lives. And so I'd like to end by just acknowledging my collaborators. So GLSEN for helping me distribute my survey, Dr. Sievertson at the Search Institute, a colleague at Kent State University, students who make this effort even more meaningful and valuable, and then of course the NIH Loan Repayment Award that has paid for my time over the past 2 years to do this work. So I'll end now, and I think we have about a little more than 15 minutes for questions, so I'd be happy to answer any questions.
Sorry. So I thought it was really interesting that in your first paper, or first snapshot, the LGBTQ victimization didn't seem to matter. And I'm wondering if that could be an artifact of having GLSEN as an example, and that membership or connection with GLSEN means that that is providing some support for that identity?
Mm-hmm. I think that's a good question, but GLSEN publishes data every 2 years on their National School Climate Survey, and over 50% of kids on their surveys are experiencing victimization at schools, and sometimes upwards of 80 and 90% are experiencing that, and so they may be part of GLSEN because they need that support, because they're not getting it at their school.
Right, because the connection was victimization to depression and self-esteem. So it wasn't saying that these kids are not victimized, it was just saying that that wasn't then connecting to self-esteem or depression, right?
Right.
And so maybe,
right. But they find those associations in their data. And so I would think that if there was a moderator that's not included in this model, that would show up as, potential it wouldn't be significant in their data either then, because they're surveying from the same sample. I really think it has to do with the race ethnicity piece, because we have found that in other LGBT studies within those group studies, that for white youth, it appears that victimization is most strongly related to sexual orientation, to well-being for white youth and not for youth of color. And perhaps it's something protective related to their race ethnicity, their experiences that they've had before, their experiences of parent preparation for bias related to race ethnicity that are actually protecting them against any additional bias they receive because of other identities and locations.
I just want to have a comment that I thought was, I just thought that was interesting. I'm wondering if you could talk about it a little bit more. The external assets, there wasn't a difference by urban and rural, right?
No, there was not.
And that's so fascinating because you had 47% rural, and you would think that I was thinking about this, but family of choice, like you have access to community centers in the more urban context. So I was thinking about that as a moderator as well. I'm just wondering, in finding that, and what have you found with race and ethnicity, with urban versus rural? Do you think there's something going on there, that it's the race and ethnicity is the more salient? I don't know. I just thought that was really interesting that you had half in rural, and yet there wasn't a difference in external assets, which I think we would assume.
Right. That's a fascinating question. Yeah. And I think it gets at the need to do like 2, 3, 4-way interaction, between urban, rurality, context, race, ethnicity, and having even I would love, we're actually doing some work with the Minnesota Student Survey, and we have received the go-ahead from the Department of Education in Minnesota to get census-level data. They're going to provide us with the identifiers for each school, which they usually do not. They usually give you a de-identified data set, so they're going to give us that. That's our RO3, is to do analyses on that work, to be able to map up, because one of our biggest questions there is rural versus urban, right? So you have Minneapolis, but then you have the rest of the state, basically, of Minnesota. And so we're hoping to get at, the context of the percentage of white, non-Latino individuals within each of those school districts, and then within the school, the proportion of racial and ethnic minority or youth of color in those schools, and look at those complex interactions. But for external assets, that's a really good question, because I think I would hypothesize, or we do hypothesize, that youth, trans youth, and LGBTQ youth, because we have over 4,000 LGBTQ youth in this sample as well, in urban environments would have greater access to these supports. But I think we also make that assumption, right, that kids in urban environments are going to be healthier or have better access to LGBTQ resources. But I think that there's just so many intersections with race and ethnicity who can access those resources in a way that's meaningful to them.
Yeah, that's interesting.
Yeah, Henry.
I just want to respond quickly. Just hopefully you could go through with a paper on seeing how parents could provide strategies to their kids on how to deal with discrimination, whether it be due to sexual minority status or ethnic minority status. Because me and Andrea put together a qualitative paper, and also with another student, Brian, seeing how Mexican origin parents are instilling these non-violent social justice ways to cope with discrimination. So I wonder if some of those strategies would cross over to help prevent non-violent or violent ways to engage in coping with discrimination due to their sexual minority status.
Right. So you're talking about parents teaching their kids how to engage in these? That's fascinating. I really want to.
I mean, I don't know if you're planning to do that, but I'm really curious to see if the strategies they're instilling in them can in some ways cross over, and regardless of which status you're looking at, helps prevent any violent ways to engage in coping.
Right.
Are those strategies being institutionalized? I mean, are they formally saying we're going to do this strategy, the Mexican American parents?
So that they may do it in really, strategically or even unconsciously or subconsciously. But I think that it may be possible that whatever they're learning from their parents, they could use it in these other cases where they're experiencing discrimination at school because they're bisexual and they're Latino or so forth. So.
Right. Yeah, I think that's a great question because I don't think many have addressed this intersection for social justice. So we do know that some kids who are involved in social justice are more likely to be involved in multiple arenas of social justice.
Especially to expect many of these parents not knowing what happens because you're a sexual minority.
Right.
How do you deal with bias or discrimination?
Right.
Maybe these strategies work just like similarly or even work the same with the status that there can be. But again, being ethnic minority is really different qualitatively to being sexual minority in many ways. So who knows if these strategies will work well across the intersectionality.
And I wonder if LGBTQ youth would learn that more so from their peers or from community organizations rather than their parents, especially LGBTQ youth who are whites and who are growing up in homes that maybe don't engage in social justice, so where that wouldn't be a component of their parent socialization. But you're making me think about my data because I do have a measure of social justice identity development in this, and to be able to look at that as a moderator and as a potential coping mechanism, and look at links with parent preparation for bias. So
really quickly, sorry, Bruce. Does it say that the social justice makes it even more salient because it's something that you really believe in strongly? So I think the effect on depression or self-esteem is going to be great because of that social justice passion that some of these youth, which I've met so many Latino LGBT, and many of them are so strongly identified with this status. So I think that
great questions. Bruce.
Yeah, well, first off, thank you for your talk. It was interesting and clear and raised many really interesting questions and thoughts. And I kind of conceptualize your research kind of in a larger area of stress health relationships, where you're looking at environmental exposures, whether it's racism or discrimination or poverty or family rejection, its effects on mental and physical health. And in that area of stress health relationships, a major focus of that area is on how stress gets under the skin, our biological embedding of stressful experiences, whether in alterations in immune function or changes in the cortisol system or in metabolic functioning. And I guess I wanted to ask, does your work kind of connect with that biopsychosocial framework at all, or do you see yourself in that direction, or is it kind of separate from that? Right.
No, I'm really glad that you asked that because the RO1 that I just briefly alluded to, two of my colleagues do cortisol analyses. And so we've talked about doing a multi-site study, or proposing a multi-site study to both have longitudinal data, but within that nested longitudinal data where we're bringing in kids daily, or having them send in spit swabs to be able to look at their stress reactivity in the context of whether they're experiencing bias, how much their parents are talking about bias, for multiple issues. So not just around sexual orientation or gender identity, but most of these colleagues are mostly focused on race, ethnicity, and poverty. So we're hoping to do that in 3 more urban type environments.
Thank you. If I could ask one more follow-up question.
Yeah.
When you put up your path analysis, you were looking at, essentially experiences of discrimination or bias and potential outcomes. And I just wonder, given that it was, cross-sectional data, do you also consider alternative models in terms of, you could fit that model in different ways. Do you consider alternative models? Do you try to test it against alternative models? Because that's really relevant. Trying to understand pathways and causal pathways and intervening mechanisms is really critical if you want to move to the prevention intervention level.
Right. And in this format, since it is cross-sectional data, I haven't yet tested, so this is like brand new analysis, so I haven't tested multiple models. I think that's definitely a good future direction. I think where I'm going is that longitudinal data, so that we can more appropriately get at causal linkages. But I definitely think, there's definitely research showing that youth who are more depressed, have lower self-esteem, do report higher levels of bias, especially attributed to a position that they hold in society. And so we don't know, it's a chicken and egg problem. And with our data currently, not many people have longitudinal data that are able to look at this in a more meaningful way for prevention intervention. So that's definitely where my research is headed, is finding these samples to do longitudinal research. And I think that with IRBs changing, becoming more readily willing to work with people who study LGBTQ issues, some neuroscience research that's coming out, saying that deciding whether to participate in research is one of those, cooler issues that kids can do at 14, so we don't need their parental consent to engage in these research, these types of research, I think, is just only going to allow for this type of research to happen.
So you mentioned earlier, you didn't include it in this presentation, you mentioned you going forward, you're starting to look at identity processes for both sexual orientation and race, ethnicity. Could you speak to that for a moment?
Yeah.
In the future, what you're hoping to look at?
Yeah, so a lot of my postdoctoral work and my work as an assistant research professor at ASU is focused on ethnic identity development among Mexican origin adolescent mothers. So very, very specific sample. So that in that study, I used Adrienne Taylor's ethnic identity scale, which she just revised at SRCD in her invited talk to call it racial ethnic identity. And so I adapted that measure actually to get at sexual orientation identity processes. So all of the sexual orientation identity measures that I could find in the literature really tap into internalized homonegativity or internalized homophobia. And so we're not really assessing the developmental nature of identity development, of exploration and resolution from a more Ericksonian or Marcia perspective. And so in this data that I collected, I am assessing exploration related to sexual orientation identity and resolution of that identity using a very similar measure to the racial ethnic identity scale. And I assessed race ethnicity identity development so that I could look in like a profile analysis to see how these things are playing out together simultaneously. So
I'm going to just stick my neck out here because I don't know this literature. But with Latino youth, how does machismo play in? And then for African American youth, how would virility play in? Because those are very strong cultural components.
right.
Did I stick my neck out too far?
No, that's a great question. And a lot of qualitative work has actually looked at Latino gay males' experiences of machismo and how it influences well-being. And we actually see it play out in families as well. So a lot of the qualitative family stuff has said that for parents who espouse higher levels of machismo values, that they're the ones who are having a harder time with
That's what I would
their
say.
children
Because
being.
last night at dinner, we started to talk about my African-American law professor friend at Indiana University, and he was always convinced that black males had a tougher time because of their cultural notion of virility, and that played a big impact on it. I never got to that story last night.
Right.
We were busy having great food or something. I don't know.
Yeah, I mean, we definitely see it play out in family relationships and parent dynamics. There has been much less work, though, looking at the adolescent level within this population of LGBTQ young people, how that plays out. And so I did also measure in this study, measured so many things in this study. I have a gender role attitudes and a machismo subscale of the acculturation scale. So.
And then for me and my interests, your social support scale from the Research Institute,
Yes.
how many questions or how specific do they ask questions about extended support, especially because we know that minority people live in these extended family networks. So it's important to ask or to find out how specific are they getting with the information as to who some of these support networks are, because they can be major buffers in
Right.
identity development and prosocial well-being.
Yeah. So in my study, I ask about like every family member that you could ever think of, extended kinship networks, and various individuals' level of support. The Search Institute, they primarily focus on parents, but one of the items that taps into that support domain does ask about other family members other than parents. So it's probably not getting, I mean, Search Institute is there are some criticisms of the Search Institute. It's, traditionally been very focused, and it was developed from a very privileged white heterosexual male, high socioeconomic, Christian perspective. And so right now, I actually know from my colleague that they're going back and revising the 40 developmental assets. So they're actually planning to come out with actually a new model, a revised model. They're changing some of their items. I'm hoping that I'm included in some of those conversations now that I have my foot in the door there, to help them think more broadly, because it's the whole team there is still very monolithic. So, it is important, but it's also hard when they're serving so many different schools to be able to incorporate a wide variety of items that would tap into anything specific to being a person who has a marginalized identity, because they can't, at that level when they have their 160 items that measure developmental assets, to add any more to that is difficult. So, but very valid criticism of their measure. Any other questions? I think we're out of time. Great job. Thanks.
Give you time to prep for your next thing.